Glaucoma. This video has been produced for patients diagnosed with glaucoma. There is no cure for glaucoma, but treatments are available to delay the loss of vision from glaucoma. Glaucoma is hereditary, so family members should have annual glaucoma eye examinations. If you have been diagnosed with glaucoma, it is important to know as much as possible about this disease of the eyes. You may not have noticed any symptoms, but when the pressure in your eye was checked by the optometrist, this was too high, which is one of the signs of glaucoma. An elevated pressure of fluid inside your eye creates gradual but irreversible damage to the optic nerve at the back of the eye. The optic nerve sends visual images to your brain. If this nerve is destroyed, vision is lost and cannot be restored. When an elevated eye pressure is diagnosed by the optometrist, you may be asked to come back for another appointment at a different time of the day to double check the eye pressure. There will be no charge for this appointment. The next step to see how far the glaucoma disease is would be to visit the glaucoma specialist for further tests. Part of these tests means your eyes will need to be dilated with eye drops to widen the pupil. As this can make your vision blurry for a while, coming with someone to take you home is a good idea. The first loss of vision with glaucoma is peripheral vision. This is the vision to the sides. To check on this peripheral vision loss, the nurse will ask you to do a visual field test. This might be a large machine you sit at or a headset you put over your eyes. You are asked to concentrate, focus straight ahead, and flashing lights appear around the edges of your vision. You press a button every time you see a flashing light. This is a painless test, but takes a lot of concentration, but the nurse will guide you through it. The printed results from the visual field test will show the ophthalmologist if you have lost any peripheral vision. The ophthalmologist will repeat the eye pressure check using the slit lamp and a tonometer, and will also measure the thickness of the cornea. This test is called pachymetry and is painless. The ophthalmologist may also do a gonioscopy test. This is using a special lens to see the outflow of the aqueous liquid in your eye and determine if there are any blockages which are causing the buildup of fluid pressure. The final test is the most advanced as it can detect damage to the optic nerve at the back of the eye. This test is OCT, Optical Coherence Tomography. Again, this is painless and will be done by the nurse or technician at VE Medical. Once the glaucoma specialist has all these results, he can assess how much damage has been caused by the glaucoma disease and suggest the best treatment plan to delay further loss of your vision. You will be prescribed daily eye drops to control the buildup of eye pressure. There are several types of glaucoma medication. The ophthalmologist will prescribe the best one to control the symptoms and the stage of the disease. As the disease progresses, these eye drops may need to be changed. Glaucoma eye drops are available in branded or generic form. The generic eye drops are less expensive. These eye drops will need to be used every day to control the fluid pressure in your eyes. Discuss the cost with the nurse so that you can replace the eye drops every month. If you have difficulty putting in the eye drop, the nurse will show you, or a family member, so that you put in the correct amount and don't overuse them. The nurse will explain how long the bottle of eye drops will last. It is always best to buy the next month's supply before the end of the month so you don't miss any days. Is surgery possible with glaucoma? Yes. Glaucoma surgery can be discussed with the ophthalmologist once the eye pressure is stabilized with the eye drop medication. There are different surgery options possible. The main purpose of surgery is to open up the meshwork which drains the fluid from the eye. The meshwork is called the trabecular meshwork. A laser can be used to open up the drainage tubes within your eye, which allows more fluid to drain out, and this reduces the pressure inside the eye. At VE Medical, the latest Iridex micropulse laser is used for this treatment. However, it is important to understand that laser therapy is not a cure for glaucoma, and the eye pressure lowering effect can wear off over time. The good news is that laser treatments can be repeated. There are also surgery procedures which can help to open the drainage in the trabecular meshwork. Stent implant or an Ahmed valve implant surgery are performed at VE Medical as a same-day surgery. These devices are implanted during a surgery procedure to provide a more permanent opening to drain the aqueous fluid from the eye to reduce the eye pressure buildup. The doctor and nurses at VE Medical will fully explain the surgery if this is an option for you. A third surgery procedure to open up the meshwork to drain the eye fluid is called HFDS, high frequency deep sclerotomy. This surgery uses a special special probe with Ortley equipment to create several holes in the trabecular meshwork without the use of implants. VE Medical is the only surgery center in the Caribbean performing this surgery. We hope this video has helped to explain the disease of glaucoma and what treatments are available to delay the loss of vision. The main points to remember: there are no symptoms to tell that you have glaucoma in the early stages. The only way is to do a comprehensive eye exam, including a glaucoma pressure check. There is no cure for glaucoma. Treatments and surgery are used to delay the loss of vision from glaucoma. Glaucoma can be hereditary. It is important you let immediate family member know you have glaucoma. They can then arrange annual eye examinations. The sooner glaucoma is diagnosed, the easier it is to prevent vision loss from this disease. Daily control of the eye pressure is the only way to delay the damage to the optic nerve and delay loss of vision. Vision Express Medical, Orange Grove Plaza, Waterwash, St. Lucia.